More than 80 million Americans now told to stay at home.
If you're a nursing school student, a medical school student, we need you.
Now to America's hospitals, trying not to buckle under the pressure of the outbreak.
We're asking all medical professionals, physicians, nurses, physician assistants, and all members of the healthcare team to join us to take care of Californians through this surge.
Shocked is one way to put it. I think we hear that with the coronavirus, healthcare workers are in demand and you should be on the front lines, and I wanted to help, and I never thought I would be filing for unemployment.
Sarah Serona is a certified pediatric nurse practitioner, and despite this seeming to be a time of need for medical professionals, she was laid off.
I even joked with my husband. I said, well, I'm so glad we don't have to worry about our jobs, and I literally ate my words like 2 days later.
Out of concern of retaliation, she agreed to share her story as long as we didn't include the name of her employer, but she described it as a large and well-known hospital in the Sacramento area. That's why when the coronavirus pandemic began impacting the United States, she was ready to face the front lines.
Never had trouble finding a job or keeping it. I've only worked at 2 different locations over the past 15 years and always found good employment.
But what happened wasn't what she expected.
Just all of a sudden, the patient load dropped more than in half. I didn't know that I was laid off or furloughed at first. It started very slowly as of like, we want you to come today and we'll let you know about tomorrow, and then tomorrow never came because the patient numbers dropped off so quickly.
And shockingly, she's not alone. California hospitals have been hit hard financially, not necessarily by the coronavirus surge, but more so because of a lack of patients. So I'm curious if we've done such a good job of flattening the curve and staying at home about this idea of a surge or lack of one, and how that's impacted our hospitals here in California.
Of course, hospitals, first and foremost, have been focused on the right things, and that is caring for each and every patient that is in front of us. But what it meant to be able to prepare for this crisis is that hospitals had to empty their facilities. We have to empty emergency departments, empty beds to make way should we need to care for COVID-positive patients. And what that has meant is a devastating financial impact.
In fact, it's been so devastating that the California Hospital Association says hospitals in our state are now $10 to $15 billion in debt following the coronavirus pandemic. They estimate during every month of the pandemic, $2 to $3 billion are lost.
Just like other businesses in the economy, restaurants, movie theaters, retail stores, hospitals get paid for every patient that they treat. But unlike all of the other businesses in the economy and even other healthcare providers, doctors, dentists, we couldn't turn out the lights and go home. We had to be there, ready, in the event that there were COVID surges. Not only did our revenue decline, but our costs remained and in fact increased during this COVID period.
That's why the California Hospitals Association last week asked state and federal leaders.
We sounded an alarm bell.
For $1 billion before the end of this fiscal budget year, which ends on June 30th, and then asking for another $3 billion in the new fiscal year, which they hope the federal government will match dollar by dollar in order to help alleviate the financial burden the coronavirus has caused.
This will have financial impact for a longer period of time. What's really happened to a hospital is we've taken their financial security and we have really ruined that record. So for hospitals over the longer term, they don't have the cash on hand they need.
But ensuring hospitals have the cash they need to remain open isn't just for health reasons. It's also for our overall economy's health.
Hospitals are one of the largest private sector employers in the state of California. So we employ 500,000 people. Hospitals create 1.2 million jobs and are responsible for some $268 billion in contribution to the economy. It's the best and easiest way to keep this economy going and to restart it again.
And yet it's not something that has started to happen, despite the slow reopening of some businesses.
Some hospitals are resorting to layoffs and furloughs and asking employees to use their paid time off. It is not what we want to do. We've got to make ends meet.
Yeah.
Right now, we're looking at those temporary staff reductions.
And major hospitals aren't alone. It's impacting overall healthcare, including many independent, private, and family-run practices who are also struggling.
It's like a small business. So if your practice goes away or is pretty much diminished.
In fact, the California Medical Association said a survey they did of 3,000 physicians showed that half of those doctors had to furlough or lay off employees, and that 80% of small practices said their revenues declined by mid-March.
There's a lot of hurting docs out there, and oddly at a time when physicians are in need.
Dr. Price runs his own practice here in Sacramento. Because of the PPP loan, he was able to keep his staff working for the most part, but it's something he's worried about in the coming months. Kind of talk to me about the business aspect of it.
That's the part that's scary, honestly. Our volume is down. And so if you're down 10-20% volume, basically you're working for free. You can't work. Your business can't survive. And I honestly don't know if the model switches enough. I don't know if we can survive. So if my model gets it so I can only see 80% of the patients that I used to see, I'll have to close.
All experts we spoke with say a huge part of the issue is people not wanting to come into hospitals or doctors' offices of fear of a greater chance of contracting COVID-19.
We're deeply concerned that people are postponing services that will result in them getting even sicker later.
I've had people with chest pain not come in, and then it's days later they finally come in. That is a big issue.
That's why they're trying to get creative. Many smaller-run physicians have resorted to telehealth or doctor's appointments by phone and video call.
Kind of way I look at it, of every crisis is opportunity. You know, and there's opportunity for us to shake things up and work outside of our comfort zone.
I think the amazing thing was how quickly it changed from seeing 20 patients for me and maybe 15 or so for my nurse practitioner in a day to almost nobody coming in. We switched to telemedicine and phone visits. Really in a day.
But doctors are concerned that not being able to see patients in person heightens the possibility of missing physical red flags.
I'm not going to hear that heart arrhythmia that developed since the last time they came.
With Newsom announcing the first step of reopening being allowing essential surgeries, medical professionals hope patients will return, helping both their own health and the business side of the medical field.
I want to reassure the public the safest place to be right now is in your doctor's office.
In the meantime, the California Hospitals Association and medical professionals alike hope the state and federal funding they're requesting helps ease the burden of the billions in debt they're currently in.
If hospitals do get extra money from the government to help them during the difficult time, I hope that they are able to use it to help nurses and doctors return to work and to support the community and public health at large.
I think the bottom line message is that hospitals were there to protect California. Now is the time for California to protect hospitals.